Here's what you missed from Glaucoma 360. Hello and welcome. I'm Carey Powers, and we are live at the Glaucoma 360 New Horizons Forum in San Francisco, where the brightest minds in ophthalmology are gathering to push the boundaries of what's possible in glaucoma treatment. Today, I'm excited to welcome our guest, Dr. Tosin Smith, a glaucoma specialist at Glaucoma Associates of Texas and adjunct associate professor of ophthalmology at UT Southwestern Medical Center in Dallas, and Dr. Davinder Grover, a glaucoma and cataract surgeon at Glaucoma Associates of Texas, who leads the practice's clinical research efforts. Thank you both for taking time to join me today.
Thanks for having us.
Thank you.
So, Dr. Smith, first allow me to congratulate you on the President's Award last night at the GRF Gala. It was wonderful to be in the room and see your whole practice here and your family to help celebrate your achievements. So congratulations.
Thank you so much.
So, Dr. Smith, you've practiced and taught ophthalmology on several continents and now oversee efforts like the Cure Glaucoma Foundation while continuing to care for patients in Dallas. How have these global experiences shaped the way you think about glaucoma care?
So I'm actually a Nigerian and I trained outside the country. So having an understanding of, having a worldview is what I would say of the fact that glaucoma affects everybody across continents, and it is a debilitating disease in certain instances. The Cure Glaucoma Foundation, which was formed in the Glaucoma Associates of Texas, probably going on 15 years ago, has given us the opportunity to reach across the world to share the knowledge and skills that we have in training glaucoma surgeons to help them take care of patients that are local to them. So I know we're busy in our individual practices, but in our practice at Glaucoma Associates, we have made room for the opportunity to do this because we realize that it's one thing to go across the world and do surgery on people and come home, but it's a completely different thing. And we have models that are changing eye care in countries all over the world where we teach surgeons and we create opportunities for them to continue to train on that particular surgical skill. That has caused, for example, in Nigeria, for you to go from 4 surgeons who know how to do a procedure to now we have over 40 surgeons scattered all over the country, which means blindness from glaucoma for the long run at least has been prevented. So it's a privilege for us to be able to do that. It's busy because we have normal clinical lives and we have to do our day job, but it's also fulfilling because that is who we are at Glaucoma Associates. We're those people who care beyond ourselves.
That sounds very rewarding. Dr. Grover, have you also participated in the Cure Glaucoma Foundation?
Yes, yeah. I mean, Tosin obviously helped start it, and then we all were involved, and it's something that we use again to provide better research in glaucoma as well as education and travel around the world to teach and plant those seeds that can continue to grow without us. So it's a big part of our practice and who we are. And we do travel a lot to Central and South America, to Asia, to Africa, to really help continue to educate surgeons and specialists. And we do that through our foundation.
That's phenomenal. Thank you for that amazing work. You both led a panel today on how devices are advancing glaucoma care. So in recent years, how have devices changed the landscape of glaucoma treatment? Dr. Grover, let's start with you.
Yeah. For a very long time, glaucoma is dependent on devices, starting back to glaucoma drainage implants, 40, 50 years ago. And it just highlights the importance of a team approach to treating glaucoma. It's not just a surgeon doing a surgery, it is the interaction between the surgeon, the patient, their lifestyle, and also industry. And when you speak of devices, you speak of, industry providing those devices, providing the innovation for those devices, and then surgeons providing the feedback to help, tailor those devices so that we get the best outcome. So it's glaucoma surgery would not be what it is today, and glaucoma care would not be what it is today without the collaborative efforts of surgeons with industry to provide instruments and devices that make our lives and our patients' lives easier.
Dr. Smith, we're here at the Glaucoma 360 New Horizons Forum, thinking about the future of glaucoma care. So what devices are on the horizon that you are most excited about in terms of glaucoma treatment?
So it was really exciting session for us this morning because we had a varied spectrum of devices that we actually had presented at a session. We went all the way from the trabecal meshwork to the canal, suprachoroidal space, subconjunctival outflow drainage implants, and all the way out to retina and markers in the retina. I'm just so excited that we're at the point where we have a device that's even approved to be able to help to tell us, what's going on in the retina in terms of retinal cell death and that type of thing. And we have come a long way in glaucoma. So we're super excited about some of these technology that are being modified. We've had a great run in the past 12 to 15 years with minimally invasive glaucoma surgery, some of which we talked about this morning. But now what we see is innovators going back and modifying and retooling and trying different things to even further advance the knowledge that we've gained in the past 12 to 15 years. So I would say exciting times. We're going beyond what we've learned in 12 to 15 years. We're trying through some of this technology as well to be able to go back to the FDA, probably to say, okay, we've learned some things in the past few years that help us better manage our patients. They give us more information. Maybe it's time to reset how we set clinical trials, how we set endpoints, and the things that we look at to make decisions on the clinical trials that we present to you as it regards our patients.
Dr. Grover, what are you most excited about in terms of innovation and devices?
There's a lot of exciting things happening in the session today, which was really nice. We're seeing a transition to, what we need, right, is safe, straightforward, effective procedures with minimum follow-up and being delivered in a way that's cost-effective to the system. So we were seeing technologies today that are office-based, well tolerated by the patients. Other technologies that are allowing us to detect glaucoma damage early so we can intervene early. Technologies that can provide surgical interventions that have a rapid visual and physical recovery with good efficacy. So we're really trying to fine tune these surgeries that can really allow our patients to preserve their vision while preserving their quality of life. And that's one of the more exciting things about the session. But talking about what Tosin just talked about, which was this collaborative effort, but also working more closely with the regulatory agencies like the FDA. Thinking back 15 years ago, the patients were being enrolled in these trials that were end-stage eyes. This refractory glaucoma have had to have multiple prior traditional glaucoma surgeries, and they were very reluctant to any type of intervention to these eyes. Now that we're having very good evidence on the safety of these interventions, we can now redefine, and we should redefine, when an intervention should occur and which eyes we can start helping at hopefully an earlier stage, so that we're not taking care of these end stage conditions. We're intervening earlier to prevent the devastating outcomes of glaucoma.
Very good. Well, here at the New Horizons Forum, we're coming together as a broader glaucoma community. How is this collaboration instrumental in advancing the field of glaucoma?
You can't make changes on what you don't know. So I think the first thing that we gain here is the knowledge. We gain insight into new things that are being found out in our disease state. And based off of that insight, we can then go out of this space and collaborate with our colleagues to say, you know what, there is more that we know now that allows us to institute better change. Change not only in our office practices, there are campaigns now about interventional glaucoma that probably started here with some of those devices 10, 15 years ago that are now being used and now allowing us to change what we do. Change like neuroprotection. That's a big thing around here. And we had a great lecture this morning by Dr. Eugene Dehan, who that actually, talked about neuroprotection and where we've been, where we are now, and what we need to do in the future. But currently, there's stuff that's available. And until you leave here and you're able to go back and create, not really policy, but mostly you speak to your colleagues about what you've learned, and then you can provide better for your patients. So I think New Horizon definitely provides insight and education that allows, people that do what we do every day, then go back, whether it's to our societies or our groups, to say, we need to change something about how we care for patients. Dr. Grover?
And the most telling thing that I've seen is just it's nice to see when I come to New Horizons and the Glaucoma Research Foundation, and it's nice to see who's at the tape, all right? Because you need collaboration. It's not just Dr. Grover and Dr. Smith seeing patients. That's not the healthcare system, especially with glaucoma care. It's what we see at the table at this meeting are physicians, we see patients, we see industry, and we're all talking together and working together to advance the field. And that level of collaboration is the only way this stuff happens. And when you see the emotional investment, the intellectual investment, and the financial investment all coming together, it's how innovation happens. And that's one of the most exciting things that we saw in our session and that we're going to see throughout the day.
Well, very good. Thank you both for your time here at G360 and also for the amazing care you give to your patients in Texas and abroad. So thank you for the work you do.
Thank you so much for having us.
Yeah, thank you.
For more information on the Glaucoma Research Foundation's efforts to cure glaucoma, visit glaucoma.org.